So first of all, welcome to all of you. We are really a lot today, and I can see from all over the world, including Honduras. But also we have United States and Europe and South America. Really, the globe is with us. And so welcome to this webinar with Professor Hagai Levine. I'm going to introduce him, but first I would like to remind you that the lecture will be around half an hour, and then you can ask your question through the chat or through your digital hand, and I will open your microphones. So Professor Hagai Levine is an Associate Professor of Epidemiology at the Braun School of Public Health and Community Medicine of the Hebrew University-Hadassah in Jerusalem, and the chairman of the Israeli Association of Public Health Physicians. His research focuses on translating scientific knowledge into health policy in several areas. Professor Levine combines in his academic career the vast experience as leading public health professionals at the Israeli Defense Force and Ministry of Health, and continue to advocate for public health as a member of national and international committees, including the Israeli National Expert Panel for COVID-19 response. He is specifically interested in promoting scientific-based preparedness and response to global and local threats to public health, such as climate change, pandemics, and chemical toxification. So, Professor Levine, now the floor is all yours.
Well, I'm very glad to be with you tonight. I just got vaccinated 2 hours ago in Hadassah and Karem Medical Center, and I feel well. However, if I make any errors during the talk today, it's because of the vaccine. So,
hopefully not.
Hopefully not, of course, joking. So I want to share with you my insights looking back, looking at the present, and looking toward the future, what the COVID-19 syndemic can teach us. And I will elaborate why I say syndemic and not pandemic. As mentioned, I am first and above all a professor at the Hebrew University. Both my parents studied at the high school near the Hebrew University, got married at the Hebrew University, and they and also my grandparents studied at the Hebrew University, so our family is tied with the Hebrew University. But beside my academic role at the School of Public Health at the Hebrew University and Hadassah Medical Center, I am also an advocate for public health as chairman of the Israeli Association of Public Health Physicians, and many other roles at the national and international levels. So, you know, as many people in Israel, I wear several hats, and I will try to show different angles of the events in Israel that can teach us key lessons for everyone, every country around the world. Of course, now the hot issues are the vaccines and the mutation, and I will elaborate with that, and we will have some time for questions and answers later on. And I received some of your questions, and not only in light of one of the questions, but I must say I don't have any conflict of interest regarding anything that I will talk about. Here is my email. You are welcome to interact with me. You are also welcome to follow me by Twitter, right? Levine Hagai, and you can find me. And I share my insights also using Twitter during the events. So we need to go to the source first. And if you look at the Mishnah, you see, know from where you came and to where you are going, and before whom you will have to give an account and a reckoning. Now, this is a crucial issue, accountability. That's what we demand from our governments, from the decision makers. And you know, in Israel, they said all the time at the beginning, you know, what would be the price of making a mistake, מחיר הטעות. But as I will elaborate now, it's a two-edged sword. We have tough decisions because a lockdown that is too severe, that's also a terrible mistake, because that's also harms public health and of course also society and economy. So we have to choose between very difficult choices with a lot of uncertainty. Even with the vaccine, and again, I will elaborate toward the end, but you know, we trust the process. It's very promising results from the clinical trials, safe and effective, and transparent and professional regulatory process. Still, no one really knows what will happen in the future. So I'm just saying that the thinking, the scientific thinking, the public health principles of involving all the stakeholders, of looking at the evidence. As you know, I taught for many years, I taught Israeli and international courses in pandemic preparedness. And my motto for the course, which I studied as a junior in the Scouts, be prepared, be flexible. It's our obligation to prepare as much as possible for every step. For now, for example, for the vaccine operation, but we need to be flexible. We plan something, now we have new data, we find something different, we will change. So again, I'm saying, about the vaccine, I'm very supportive of now taking the vaccine, and I got vaccinated today. But I'm just saying that decision is also based on follow-up, on ongoing follow-up. We need to check all the time what is the impact of the vaccine, not only on the individual, but on the society, on other issues. Maybe people, because they get vaccinated, they are less careful. I'm just saying, we need this critical thinking. This is critical. But still, today, you know, that's the shortest day of the year. And from now on, every day, there is more light. So I hope that we also see the light at the end of the tunnel. So where I come from, not only from the Hebrew University, but I come from public health. And if we follow the compass of public health, even if the decision with time will turn to be not the best decision, we know that we did our best to try to get the best decision. And this is what's important. We have to acknowledge the complexity. You see in the yin and yang, in everything that is bad, there is something good. And in everything that is good, there is something bad. So an outbreak, a pandemic, a crisis is also an opportunity. Do we really fulfill this opportunity? Are we just putting a bandage? Just, okay, so we found a vaccine for this one disease. Did we really learn our lesson to put the health of populations at the center of decision making in Israel, in other countries, globally? What's more important than our health and sustainability as individuals, but together we are all the public. Now, if we look historically, you see here, 50 years ago, because infectious diseases have been largely controlled in the United States, we can now close the book on infectious diseases. The Surgeon General, he believed in that. But of course, he was wrong. And that's the hubris, is very dangerous. At every step, again, I warn now, when we have a vaccine, and you know, still we have difficulty with vaccine delivery, and now we have the mutation, and who knows what will happen. We have to be humble. We have to continue studying and researching all the time. Be prepared, be flexible. And if you look at the crude death rate for infectious diseases, you see it's not only about vaccines. You see here in the graph, health departments chlorination of water, of course, this is circumstantial. Does not mean that it's necessarily causal. We need to study that. We see here the peak of the pandemic influenza of 1918, 1919, but back to normal, antibiotics, vaccines, and we reach somewhat of a plateau. But every now and then, and we do not get to zero. We cannot close the book. But we have learned from reality in economics, but also in health, in public health. There is the black swan phenomenon. You can have great time for a long run, but one day you can lose the earnings of the stock market of 30 years. One pandemic. We should never underestimate the health risk. One pandemic can kill millions of people. It's possible. Even if an event is very unlikely, but if it will happen, it will be a catastrophe. We need to be prepared for that. We need caution. And we have seen, you know, all kinds of disasters. We have seen all kinds of pandemics. But again, I'm saying that, and the complementary. We should always remember that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Meaning, public health is not only not getting sick or dying from COVID-19. Even in a pandemic, you need this comprehensive understanding and view. Does it help if someone died from a lockdown, but not from COVID-19? Is that better? Of course not. So in every decision, we need to balance. We need to make sure that we are making the right decisions, that we maximize the benefit and minimize the harms. And of course, if we have an economic crash, if we will have now 4 years unemployment and poverty, that's major risk to health as well. Many people will die because of unemployment. So we must take that into account. Look at the broad picture. No medicalization, not looking only at the virus. It's bigger than the virus. That's why I'm saying not a pandemic, a syndemic. We have several problems. We have people with obesity die more from COVID-19. So we should also tackle obesity and poverty and addictions and violence. And in every decision making to take all that into account. It's difficult, but that's our responsibility. There is no public health without the public. A government, any government, can say that or that. But if the public do not have trust in the government and do not follow, that's the worst. It means that the steps are not really fulfilled, so we are not preventing the spread, but also we suffer from the hazards of the instructions, lockdown restrictions, whatever. Here is a photo from the 2011 demonstrations in Israel. The public demand social justice. What they didn't know, as I say, they wanted public health. They wanted to live in a healthy country. And that's what most people in the world want. But we always neglect public health. That's the prevention paradox. As Johnny Mitchell said, right? She sang that we don't really appreciate what we have until it's gone. Health promotion. How do we get people to wear masks? How do we get people to get vaccinated? Not by orders only. Health promotion is carried out by and with people, not on or to people. It's not effective. The most effective way. And now with the vaccine, if people are hesitating about the vaccine, the public health approach is not to tell them, you are stupid, you are wrong. No, is to listen to them, to understand what is the question really about, to answer it professionally about the facts, but also about the emotions, about the fear. And it's good to be skeptical about the vaccine. Of course, you should be skeptical about the vaccine. You don't know enough about it. No one knows enough about it. It's new. It's outstanding that scientists were able to develop a new vaccine so quickly. So we should know what we know and what we don't know. We don't know the effectiveness on the long run. Actually, we don't even know if the virus will be the same virus. We don't know the long-term side effects. We don't know how it affects people, like pregnant women, etc. So again, it does not necessarily mean that we should not vaccinate pregnant women or allow them to make their choice, to choose themselves. But we just need to be transparent and professional all the way. And I cannot ignore in Israel, with the politics being the main force in decision making, and the same in many other countries. And I recall watching The Twilight Zone, a book from the alien to serve men. But do you know what kind of book it was? How to serve a man. It was a cookbook. Does government make decisions for the benefit of the public health or for other commercial, political, or other vested interests? That is an important question. We should not get anything for granted. It's good that people ask questions, and accountable government can answer very well. Yes, we need to do restrictions because it's necessary to protect the health, but you don't, and it's okay to enforce. If someone got an infectious disease, he was diagnosed with infectious disease, and he must be isolated, and he violated the isolation, that's a very severe issue and that need to be punished with enforcement. But if an Israeli woman, age 75, is sitting alone on a bench, drinking coffee, putting her mask away for drinking coffee alone, and she gets ambushed by policemen, that's not good. That's not helpful for public health or for the public trust. So we need to keep the right balance all the time. Not only use fear to affect people. We must also give them hope. We must convince them. It's the long way, but the long way is in public health is the short way. We need health in all policies. This is an approach to public policies across sectors that systematically takes into account the health implications of decision, seeks synergies, and avoids harmful health impacts in order to improve population health and health equity. We need that before the pandemic and after the pandemic, but also during the pandemic. How can you make a decision to close down the schools, the kindergartens, without balancing what is the benefit, but also what is the harm to the health of the young children, which clearly, and it was clear from very early, clearly for their own benefits, clearly they should go to kindergartens, because luckily for us, children are really a very mild disease, COVID-19 disease. Very rarely we see severe complications and death among children. So for them, clearly it's better to have the kindergartens open. Look at the root causes. Where did it come from, the COVID-19? So we know that there are factors that increase zoonosis emergence. And most infectious diseases, new infectious diseases among humans, are zoonotic. Zoonotic meaning disease transmitted from animals to humans. And you see the reasons: antimicrobial resistance, intensified agriculture and livestock production, illegal and poorly regulated wildlife trade, climate change, deforestation, and other land use changes. So when we respond to the pandemic, we cannot only look at the surface. We need to go into the root causes and to see how we prevent the next pandemic. Otherwise, we miss this wake-up call for humanity while we are busy washing our hands or wearing our masks. This is my beloved grandmother, Hagai Levine, 93 years old, public health nurse for most of her life. And when I make decisions, and when I have public health dilemmas before, but now during COVID-19 pandemic, I think about her. Would it be good for her or not? And by the way, she said from the beginning, I don't want that for me. You will crush the future of my grand and grandchildren. We need to make balanced decisions. And you know, at the beginning in Israel, and for a very long time, family members were not allowed to visit their own family members by law. This is not balanced. Why, when you make such a decision all over, you miss the case where my grandmother really needs me or someone else, and it would be more harm to her health not to visit her for any reason, even just for her mental health, than the risk of getting infected. So, you know, and if you don't allow people to make informed choices, to do risk balance, risk management on the personal level and community level and national level, then they don't trust you and you make wrong decisions, because people died of loneliness and from falling, etc., etc. Now, what are the considerations besides thinking about your grandmother or whatever character you want? We developed a framework for public health decisions. First, look at epidemiological and other evidence. Maybe you don't know for sure, but you know how many people have that and that. Okay, so we are starting to have some knowledge. And then look at all the considerations. We don't only look from a narrow medical perspective. We look from a broad perspective. The economical implications in every public health decisions, the legal implications, the ethical dilemmas, the social, cultural, and political, and I'm writing here political on the side. Clearly, in this pandemic, politics was the main issue. Logistical and technical issues. You look at the vaccination operation now. Yes, we know that we need to get the people at highest risk vaccinated first. People that are, at nursery homes, etc. But because of the cold chain, it's not easy. We need to solve these challenges, but we also need to take that into account. history and tradition, international best practice. And that's very good thing that we did all through this pandemic, collaborated with our colleagues. I have like dozens of colleagues from all around the world, from the academy, from the public health organizations, from governments, to learn from each other's experience. That's very important, to share and to learn. Leadership, that's crucial. Window of opportunity, maybe now it's an opportunity. For example, we tried for many years in Israel to ban smoking in restaurants, unsuccessfully. And it's, again, to me, it's just insane. You are, for example, in the market in Israel, they said that you have to be with a mask in an open market. You can argue with it, but that's the decision. Even they wrote in the law, you are not allowed to eat in a street market. So I was at the meeting at the parliament and I said, okay, if you're writing that with the same logic, right? You're not allowed to smoke in a market because you have to wear a mask. You're not allowed to eat. So why not say that you're not allowed to smoke? No, smoking, that's another issue. We are not dealing with that now. And it's just ridiculous because it's specifically, if you smoke, you don't wear a mask. And of course, smoking and also secondhand smoking is a risk for at least being sick. I'm not saying necessarily for COVID-19, but at least it's not a good time to get sick. And organizational considerations. The decision making in Israel. I'm just asking the questions. I'm not judging. We can do that scientifically, professionally at other time. But I'm just saying, looking, were all considerations that we discussed taken into account? What was the legal and scientific basis for the decision making in Israel? What was the process? Was it transparent? Who made the decisions? Were the decisions really implemented? Now, when you have a hammer in your hand, and the hammer is the lockdown, you see nails everywhere. And here we see the picture, the decision makers during the first part of the pandemic in Israel, Prime Minister, Director General of the Ministry of Health, which is an economic with no health education, the Minister of Health, Litzman, also without any health education, and the head of the National Security Council, who most of his career did in the secret services, the Shin Bet, in cyber, maybe saved many lives there, but no health experience or education whatsoever. 4 men making the key decisions in Israel, and the National Security Council, for some reason, had against all our plans, because we had a plan from 2007 that hundreds of people in Israel were involved, and we practiced again and again in exercises along the years. And according to the National Preparedness Plan for a Pandemic, we knew how the Ministry of Defense is supposed to be involved, the Ministry of Health, the different stakeholders, etc., etc. Not the National Security Council. For some reason, they coordinated the event in Israel, and they developed an expert panel. And in the expert panel, there were no men, no Arabs or ultra-Orthodox, no physicians, no epidemiologists, no public health professionals, mainly physicists. Now, I love physics. I was, when I was young, I was also even very talented in physics. I represented Israel in physics science competitions. But, physics is not public health. That's not the way to make decisions in public health. And all the time, they're fighting about exponential growth. I know very well what is exponential growth, where that's for physics. With humans, it's different because people can change their behavior if you know how to help them change their behavior. And at a time point, it will not be exponential. So it's a very complex issue. And again, that's in Israel. You see these quotes not now, the beginning, but against any public health recommendation, we see teams going in playgrounds and sterilizing playgrounds when, okay, you can have fear, but you can also cause damage with these chemicals and this with these findings that was not based on science. Because based on science, okay, you could be cautious when you touch the elevator keys in a multi-apartment building. By the way, even before COVID-19, I prefer to do it using my keys and not using my finger, because I know that people may transmit diseases like that. So, better safe than sorry. But you don't have to sterilize public spaces like that. That makes no sense. Epidemiological triangle, the pathogen, the virulence of the pathogen, etc., all the attributes of the pathogen. It's very important when we see when there is disease, when there is an outbreak, when there is a pandemic. The environment, the climate, the social environment, and the host for veterinarians, the animals, for humans, humans, with its immunity, with its behavior. All of this interact. You need to understand that's a complex systems thinking. So we cannot target only one thing. And even with a great vaccine, we still need to look at the broad picture. Unfortunately, we don't invest in prevention, even though 1 ounce of prevention was tons of cure. It's always better to prevent, but we don't believe it will not happen to me. Now, for example, we called for years, and we call during the pandemic to invest in the molecular epidemiology surveillance in Israel, to invest in the labs and epidemiologists that take samples from COVID-19 cases and do a genetic typing so we can see if there are mutations. But that was not high priority. So not much money was spent on that. Only now, when there are events in England, now, okay, what about Israel? Can we test the mutations? Of course we can, but we need resources. You need to, you need to train people to do that in advance. And even during the pandemic, in many countries, the medical teams, my friends, I'm a physician working in a hospital, but the medicine and technology, in Israel, we ordered thousands of respirators. And they said, the respirators, wow, the respirators. But you need someone to operate them. And do we really need so many respirators? We now know that not. So this belief in technology eclipses public health. If we invested in human resources, that would be important in any case. And now with the vaccine, yes, it's great that we are able in Israel to buy so many vaccines. Of course, it raises ethical issues. How this, getting the vaccine, shouldn't we, mankind, be with human lives, be more solidar to each other? But it's not only about getting the vaccines. We need vaccinators. We need resources to do that. And now we see that because of lack of human resources, because of Israel got one of the lowest number of nurses per people among OECD countries, it's difficult to do a rapid vaccination campaign because simply we don't have enough nurses. Think global, act local. Here we see a nice and good example how Israel prepared for Passover, had specific instructions for Passover, with working with different communities, with all kind of Orthodox, ultra-Orthodox, and secular populations in Israel, how to have a safe Passover. And again, I'm saying this balance, you see in Minerva, every decision, the cost and benefit, we have to make tough choices. But tough choices does not mean let's close down everything. If you work differential, if you are accurate, you can cause less damage from the restrictions without losing effectiveness of lowering the spread. This is a recent publication from the Association of School of Public Health in European region, and we are part of it, our School of Public Health at the Hebrew University-Hadassah. And you just see examples: lockdown-induced illnesses, addiction, diet and physical inactivity, violence and abuse, mental illness, other health issues. Maybe we have to do the lockdown at a specific time point. Sure, that's a legitimate public health measure, but we need to prepare for it. We need to use it only if we have to. We need to prepare how we minimize the side effect of a lockdown. Compare lockdown to a vaccine. A vaccine was tested in clinical trials, had a regulation process, transparent process of regulation and continuous monitoring. Lockdown, no evidence, no evaluation, process of decision making lacking, not professional or transparent sometimes. So, that's very important. You can make a decision to do a lockdown, but you have the process of decision making need to be right. But of course, very difficult when you are inside the event. The best is the enemy of the good. You need to make quick decisions. You cannot wait until you have all the evidence. Unfortunately, in Israel, and I have an MPH student, his thesis about that, Israel was very unusual in many changes in its policy. And actually, at some point, Oxford stopped tracking because there were so many changes in our policy. And on the other hand, making decisions at the last moment. In many countries, we saw, for example, the closing the schools or opening the schools were done in advance. I said, okay, that's what's going to happen, 2 weeks in advance. In Israel, last minute. My son went to sleep knowing that there is no school tomorrow, and when he woke up in the morning, they said, okay, there is a school today. From the government, not just at the local level. Always remember, not only equality, but also equity and justice. We need, you see it in the middle, that everyone gets the support they need. You say, okay, there is vaccine, but if someone needs a lift to the vaccine, we need to provide it, because otherwise those who have a private car will be more likely to get vaccinated. Of course, if we can eliminate the cause of the inequality, that's the best. Again, look at the broader picture, sustainable development goals, and see if our decisions are also relevant for the other goals, for the long run. Even about wearing mask, you have the one-time mask. Okay, I don't take any risk, use it and get rid of it, but that's a lot of waste. So you need to see the balance. Is it really worth it? Do we know how effective is the mask? And I'm wearing mask. I'm not saying against it. I'm just saying maybe we should use other kind of mask that we don't know if it's less or not less effective, but at least it's less harmful to the environment. So that's also a consideration. What do you read? The optimists see opportunity is now here. The pessimists see opportunity is nowhere. I believe that opportunity is now here. We now saw that how important is our health. And we should now change the way we live. We should have health in all policies. We have to do it. This is only one pandemic. It's very likely that we will have other pandemics during the 21st century. We will have other crises, environmental crises, health crises that we need to address now to prevent, to prepare. And then it may be different than what we planned, but we will adapt to it. So now it's the time to do it. Now it's the time, in Israel, the education system is so crowded. It's bad for the children. At regular times, they are not educated as well as they could. The education that my children got when we were in New York in small classes, it's better. So the right number, my education is not my field, but I'm just saying we had this problem with the pandemic, that it was so crowded, the classes in Israel, up to 40 students in a class. And that's not great for first graders to study how to read with 40 children in a class. So maybe we now have capsules for 20 and 20. Maybe that's what we need for first graders. As I said, syndemic, not only pandemic. We need to tackle the root causes that actually also cause fatalities from COVID-19. Obesity is a major risk factor. Not having enough specific vitamins is a risk factor for dying from COVID-19 and from dying for other diseases. The lockdown health impact, not only the immediate mortality, but also the impact of interrupted care on chronic conditions and its great opportunities. Now the health maintenance organization in Israel, what we needed to do for many years, now they operated much better process of distance service, health services, and home visits. Great. It's very, very good. And you see here the burnout, the fourth way, the burnout, the mental illness, the economic injury, the psychic trauma. We need to address this issue. Some of it is inevitable, but we should do our best to minimize. You see here a picture of people. There are hunger people in Israel, and I'm sure that in many other countries as well. So, as Arthur Conan Doyle wrote for Sherlock Holmes, once you eliminate the impossible, whatever remains, no matter how improbable, must be the truth. So the truth is that the best way is the public health way, to make informed choices, difficult choices, the right balance. We are now at increasing trends of morbidity and mortality again in Israel from COVID-19. Our response should not be complete lockdown now without any thinking. No, we need to make public health choices. We are now having a campaign, and even in a pandemic, it's difficult to get people engaged in public health and to get talented people not going only to startups, to high tech, but going to epidemiology, coming to public health, where you can save life by millions. I was asked to speak about the vaccine, and I can answer any question you may have about the vaccines. It's a fantastic scientific endeavor to develop a new vaccine, and we had a webinar yesterday with Arnold Monto, a close friend and the chairman of the FDA consulting committee, which just recently approved the Pfizer and Moderna vaccines beyond our expectations, the effectiveness and the safety of the vaccines. And there are other vaccines along the way. We see this relatively new technology, but it was used for other vaccines over the last decade of messenger RNA, make a lot of sense, probably also safer in terms of response. For example, for the oral polio vaccine or for any live vaccines, it's clearly you may have problems related to live vaccines. So if you can use such technology on the surface, it should be better. And very complex questions, ethical dilemmas. I told you about the differences between countries, within countries, prioritization. And I just want to share with you an overview. And again, I can answer specific questions, but an overview. Now, in 2009, I coordinated the Israel pandemic influenza vaccination program for the swine flu. And we summarized our lessons, and you can see here it was published as a scientific paper, the challenges and the actions that we took. And I must say that looking on that retrospectively, I see that we made a major progress over the last decade. And actually, we now, for the COVID-19 vaccination program, we have a national committee that's for the prioritization. We have central management, but also some flexibility for the HMOs. We have better communication with the public. Also, it remains a great challenge now with the social networks. It's very difficult, and you get physicians that say things that are wrong, clearly wrong, but sometimes on the back of very relevant questions and skepticism, but they take it to the extreme, and that's very difficult then to convince people. The issue of accessibility of vaccination sites, here with the cold change of Pfizer, it's very difficult, and you don't want to lose vaccines, and then people who are at most risk don't really have access to the vaccination. It's really complex issue, and very quickly you need to do it. And one thing that is not spoken enough is preventing vaccination errors. I've done many vaccinations programs throughout my career, and every error that can be made will be made. So, that's something you need to see how you prevent errors in all steps. And by the way, we have a great, advice for you in any countries that you start a vaccination program. First, vaccinate the vaccinators. When people vaccinate each other, believe me, they read the instructions very well. When they feel, they think, when they vaccinate themselves, and also when people come to them, they can say, I got vaccinated. It's very important. So not only vaccinate the healthcare workers, but first vaccinate the vaccinators themselves. We just summarized, and it was just accepted this week for publication in a leading journal. Me and my colleague from the Hebrew University, from our school, Professor Chen Stein-Zamir, who is also the District Health Officer of Jerusalem, a talented public health professional. We summarized key lessons from the measles outbreaks in Israel for the COVID-19 pandemic. And interestingly, the same lessons also apply for the vaccination program. Health promotion, social-based approach, together with communities. Proper ongoing investment in public health human resources, and we are lacking in that in Israel. Tackling the root causes of inequalities, education, employment, access to health care. Emphasis on trust and solidarity, rather than a biological notion. Social vaccine. If we believe, okay, we vaccinate, we solve all the problems. No. The poverty and hunger, unemployment, and other health problems will remain. So what we need to do is to strengthen our society, which will help us for any emergency and will help us to recover from this pandemic. Transparent communication, culturally appropriate with the people, by the people. It's great that the Prime Minister is getting vaccinated, but it's not enough. We need to see elder people from all the different populations getting vaccinated. For example, it's also true for wearing masks or for any other behavior. Political will and leadership for the protection of public health is essential against competing interests. Now, I was asked, what about the big pharma, the interest of the big pharma? I think that that's something we need to be aware of. Yes, clearly, the big pharma, some of them involved in the vaccine development, they want to earn money. They want to sell their vaccines. We need to supervise them very well. We need to make sure that they are not involved in the decision making. They should not be part of panel members or everyone that is involved in the decision making, in the professional and political decision making, should not have a conflict of interest. And sometimes this conflict of interest is complex. We need to be aware of that and make sure, because it will make wrong decisions and will also harm the public trust. Decision making based on surveillance and epidemiology at the local, regional, and national level. We need data. That's the Murphy law for you. Anything that can go wrong will go wrong. So beware. And back to my grandma, lessons, resilience, common sense, planning, professionalism, and teamwork. Remember, this is just the first wave, the COVID-19. We are going to have a recession and throughout the 21st century, climate change. That's the problem we need to prepare for and to tackle. And I'm speaking not only about mitigation, but also about adaptation to climate change. And as we started from the Mishnah, we finish, if I am not for myself, who will be for me? And when I am for myself, what am I? And if not now, when? If we will not change the way we look and invest in public health, we are not going to be prepared. And you know, countries that took the SARS lesson from 2003, Canada, Singapore, Hong Kong, China, having much better success now with the current pandemic because they prepared, they invested in public health infrastructure. Now I will gladly take questions. Back to you, Mara.
Thank you to you for your very inspiring lecture. We have a lot of questions already. I would start with a question from Viviane. She's asking why such a big effort were made to find a vaccine and much less to find a cure, and also what could be the outcome of the British variation. This is a question that other people also ask.
The outcome of the British mutation, no one knows. What we do know, that there are mutations all the time, and we need to follow them all the time. And Britain is excellent in having this surveillance of molecular epidemiology. So maybe it's also elsewhere in Italy and in many other countries, but Britain, because of its good network, found it early. What seems to be from the preliminary reports exceptional that we had several mutations, so it's somewhat more a different variant than the minor mutations that we had. The good news, SARS-CoV-2 is very different from influenza viruses. The SARS-CoV-2 got a very good auto-correction mechanism. So the mutation rate is very slow. We don't know, maybe immunocompromised person got many, because he got infected for a long time, many different mutations. We don't know yet if it will affect the effectiveness of the vaccine, if it's more, they say that not, but again, we need to see the scientific evidence. Is it more lethal? Is it more contagious? But it's not about this specific mutation. We will have mutations. We need to follow them. No one knows. Maybe we will have a seasonal COVID-19 or COVID-20, COVID-21 with different variants. Maybe we will need a vaccine for several variants. We don't know. It's a new pandemic. So then again, if we invest in the infrastructure of our health systems and of our public health systems, it will benefit us for COVID-19 and for many other diseases. So that's good in any case. That's the way to make a progress. I hope that I answered the question.
Thank you. So someone is asking also if you could please tell us about the vaccine from the IIBR, the Israel Institute for Biological Research, if it is different, if it is better, if you can explain us.
It's a totally different type of vaccine. I don't want to go too much about the details now, but I can say that it's very important for Israel to have ability to develop vaccines, the scientific and not necessarily commercial, but scientific and professional ability to develop vaccines and respond. And that's one possibility through the Biological Institute. By the way, the manager is a former manager of our School of Public Health at the Hebrew University-Hadassah. So we should invest in our academy and in our scientific centers within the government or within the academy. We do need to develop, also to have the ability to develop vaccines, even though it's difficult. Now we have a great dilemma and a great problem in Israel and in many other countries. Now we are in phase 2 of the clinical trials of the Biological Research Institute, which is, by the way, very close by. I'm in Rehovot now, in Ness Ziona. And how can you conduct a clinical trial when you already have a vaccination campaign ongoing with a pandemic and with an effective vaccine? That's very difficult, not only from ethical dilemma, but also, it's very difficult to assess the effectiveness. I don't know if they will be able to finish the phase 2 and definitely the phase 3. I don't know if they will be able to conduct a phase 3 clinical trial, and it's true for other vaccines as well. So again, the good news is that it seems like we have good vaccines, but generally speaking, if you are the first, maybe you close the market for other candidates, and maybe they are better, but they were not fast enough. So that's the way it goes.
Interesting. Okay. So another question about vaccine. We have also a question about schools and infection in schools, but first about vaccine. So he's saying, I live in Argentina. What is your opinion about the Russian vaccine, which is being imported by our government? I feel very skeptical about it and thinking of not receiving the shot.
The trust in the FDA regulation mechanism, it's not because it's the FDA. We have a phrase in Hebrew that you respect and suspect everyone. In God we trust, all other bring data. So, it's not about FDA, it's about professional, transparent mechanism. You may have seen the public hearings. We read the documents. We saw the scientific publications about the vaccines. And there is a follow-up. There is ongoing supervision after the emergency approval, and this is emergency approval. They did not cut any corners, but still, it's an emergency approval, authorization, because we have a pandemic. We don't have the time to wait, and for other more minor issues. So that's about the process. The Russian vaccine, we don't have enough information. We don't have enough scientific publications. We don't see a transparent regulation mechanism. Now, it does not necessarily mean that it's not a safe and effective vaccine, but our level of certainty is less. And again, I'm saying that even there is nothing certain. Even the level of certainty in the approved vaccine is not 100%. But for the Russian vaccine, it's much less. So it's difficult, and we definitely see here also the politics, maybe also economics, but probably mostly politics about it. So it's really difficult to say what to do. I don't know what's your position in Argentina, and you know, if you just need to make your own decision, it's difficult to know. Again, when you make your personal decision, you should see, okay, what is the risk for me of dying from COVID-19 or for having severe disease? If you are above 80, it's about 1 to 10 if you get sick. So it depends how spread is the outbreak in your country. So clearly, if you are above 80, very high risk from COVID-19. And of course, if you have specific diseases that put you at risk. So, but for young and healthy people, the risk from COVID-19 still exists. You could die from it, but low risk. You could get sick and have long COVID syndrome or have complications, but the risk is low. So then you should be more cautious with taking the vaccine, even though, you know, I think that for the Pfizer and Moderna vaccines, we have good enough evidence. So even for young, healthy people, I think it's worth taking the shot, but we should not force anyone. We can discuss that, but we should not force anyone. So it's a personal decision. Of course, with our personal decisions also interfere what the government will do, you know, like we have the green passport. Will you able to go around if you do not get vaccinated? So, you know, you need to take into account all the considerations and then make a decision. It's not easy.
Really not easy. We have a question from Guatemala. So I would like to ask what would happen in Israel regarding the Orthodox communities if they don't want to get vaccinated. They heard the immunity will probably not be reached. And the question is because in Guatemala, the indigenous communities also don't like to be vaccinated. So what happens if there are such communities in a country?
First of all, we prefer the term population immunity and not herd immunity, which comes from our fellow veterinarians. And we still don't know how much the vaccine protects you from infecting others. Still, if you protect yourself, you increase the population immunity in any case. The ultra-Orthodox communities in Israel and the Arab communities, which also, of course, in these two groups are also many different populations, they are not against vaccines, by the way, not at all. First of all, the Arabs, you did not ask about the Arab, but the Arabs get higher vaccination rates than the Jewish population in general for the routine childhood immunization. For the ultra-Orthodox, we studied that. We also studied that at the Hebrew University. Actually, my colleague, Professor Stein Zamir, who is, as I said, the District Health Officer of Jerusalem, deals with it all the time. We dealt with it in measles. They are not against vaccines. They are in favor also of vaccines. And many rabbis call to get vaccinated. The main issues for them usually that they have very large families, like on average, 7 children, some of them 10 and 12, and it's difficult for the parents to get the children to get vaccinated. And many times it's in another neighborhood. They don't even have a car. And it's just difficult for them. So we see that the first child, the second child, they get very high vaccination rates, but less for the 10th and 11th child. So what we need to do is to go to their communities, to come there and vaccinate where it's accessible for them. That's what we need to do. We need to invest. We also need culturally appropriate communication. We need to tailor our communication. Maybe for them, for example, it's not about your own protection. That's less important. It's important, but it's less protection. But it's about protection of the community. If you protect the community for the Orthodox, that's important. And of course, if it's an halacha, so just, say the same, but just say, not save your life because it's important to save the life, but save your life because that's written in the Bible, so that's your obligation. So, I'm not saying it's not a nuance. It's something that is very deep that you need, and you need people from the community. Even if I am wonderful, or anyone else, a spokesperson speaking about the issues, but if someone from the community comes and say, yes, yeah, guys, I think that's the right thing to do, that's very helpful. And sometimes it's combined. I get requests from rabbis to support and to give them some evidence, and they want to hear the Minister of Health's opinion, but they also want to hear the Israeli Association of Public Health, which is independent opinion. And they go into the details. By the way, it's very common for in Judaism, like to ask all the questions, and that's good. No problem about that. Just give transparent and accurate answers. And if we don't know, we don't know. And if there is a problem, with people with previous anaphylactic shock, of course we need to understand that and make decisions. So I think we should pay attention and have specific programs for specific populations. That's what we need to do.
Okay. Now we have a question from Carl from Germany. Are there any projections how long it will take to reach the spread of infection at a continent such as North America or Europe with the vaccination that we got so far?
As Niels Bohr said, all predictions are difficult, especially about the future. We don't even know what happened in the past. We don't even know what is going on now. So, I'm not going to make any predictions. And usually when you ask an expert in the subject, that's what he will tell you. We cannot make predictions. The virus can change. The population can change. It's very difficult to say. And what do you mean by, when it will be over? So it's not only about the virus, it's about the crisis. So when will the crisis be over? That's also politics, it's also economy. We just need to seize the day, enjoy every day that we live, and do our best to prepare for the next days. I think that we need long-term planning, and we need to have plans, but we need to be prepared, be flexible, to realize that it's going to be changed. So yes, for preparation, for example, in Israel, you can say, okay, in about 4 months, I can vaccinate most of the population. So then, the public health risk would be much, much lower. So I can go back to almost normal life. That makes sense. But maybe the virus will change. Maybe we'll have a problem with the vaccination campaign. Maybe it will be less effective than we think. We don't know. So it's difficult.
Okay, so we have a few questions about the educational system that you spoke about. If you know some percentage of, for example, teachers who got the COVID at school or children, how come most of the country, they shut down the schools quite at the beginning and they didn't begin yet?
Education is very important and very difficult decision makings in terms of education during the COVID-19. There is a working group composed mainly of professionals from our School of Public Health at the Hebrew University. They published regularly data and reports and recommendations about education at times of COVID-19. I'm not part of it, but doing great job. We know that the children are not the drivers, the engine of the pandemic. especially children below the age of 10, they sometimes get infected. Very, very rarely they get complications or fatalities, very, very rarely, and they are not the main transmitters of the disease. So you have infections at kindergartens and schools, but it's from the community. It's not the driver. So now in most countries and most places that look for the long run, open kindergartens and schools for most of the time, because the harms from closing them is worse. And that's what what we call the medicine is worse than the cure. So we should open schools for the younger ages. Maybe when you are at the peak of outbreak, what we could call in Israel the red zones in terms of geography, maybe you should temporarily close there. For the elder children, it's more complex. If you can study outside, go for it. And if you can prepare proper schooling outside, that's maybe also, regardless of the COVID-19, there are some advantages for studying outside. If you can study in small groups, in capsules, that's very important. Inside, you should ventilate. So with some instructions, you can reduce the risk. You need to think global, act local. It's different in different localities, in different towns, in different countries. You need to find the most proper solution. So there is no one size fits all, but you don't need to automatically shut down the education system, because the benefit may be very low and the harm very high. And remember, even when you close down the schools, the children continue to live and usually meet with other people and with other children. So you should compare it to the alternative. And when you compare to the alternative, you see that in many cases, in a school, it's a controlled environment. You can reduce the risk. You can find early transmission and close specific school with an outbreak. We know from a study from Henstein Zamir that was published in US Surveillance, the outbreak investigation in a high school or junior high school in Jerusalem, and there was a massive transmission there, special conditions. We know that the teachers are sometimes get infected and get other people infected. So what you really want to do is to test periodically by PCR the teachers, which could also inform you about transmission in the community, and could also help you in stopping and preventing outbreaks. In Israel, we tried that. We had some success, but we did not, we did not enforce or did not. Teachers, it's only if they volunteer or only for the free will. If they want to get tested, then the test rate are just too little people agree to be tested. So that's an issue, because you could have tested much more, but should you enforce testing? Probably not. So that's, again, complex dilemmas.
Okay, so we have a lot of questions more, but I think we have time for one more, if it's possible. And then many people are asking for your mail again, so we are going to write it in the chat. So the last question is from Holland. And what do you know about treatments like the Australian ivermectin triple, I hope I said it right, treatment?
Different treatments were suggested. Go with the science. There are, again, all kinds of treatments suggested, and some of them were proven to be ineffective. Sometimes it's also not safe. I must say something that is not spoken enough, and that about vitamin D. Vitamin D deficiency is clearly a risk factor for COVID-19 complications. It's not necessarily a proof that treating with vitamin D is helpful. But if you have if you don't have enough vitamin D, clearly it's good to take vitamin D. And many people are unaware that they have lower vitamin D. So that's something to pay more attention to and to follow the recommendation, and if needed to take supplements and to fortify food with vitamin D. Of course, also other things that are not spoken enough. Again, I'm focusing on prevention. I'm sorry, I'm not going to speak about the treatment for COVID-19. That's for the clinicians to do that regularly, but I think that we are not doing enough prevention. Physical activity is good in general, but also probably good for prevention of complications of COVID-19. Of course, not smoking. So, you know, we do need to improve our health in any case. It will also reduce our risk to die from COVID-19.
Okay. Thank you a lot, Hagai. So I think we can end this webinar. It has been recorded, so you will all receive the recording in the next few days. And please, would you like to write your mail again in the chat?
I'll write it in the chat, no problem. It's very simple. It's my full name, hagai.levine@gmail.com. So it should really be rather simple. And you see here, my child Ariel prepared a huge thank you, and I want to thank you for listening and speaking together today, and to thank all the anonymous researchers who worked for decades for the scientific discoveries in Hebrew universities and in many other universities around the world, which enable the development of the vaccines and other tools that we are using in this pandemic. And of course, all the healthcare workers and the social workers and others that are doing their job in protecting lives. We should make them our heroes, not only during a pandemic, but also throughout the years. Of course, everyone is essential. That's also to remember, but we should put much more support and investment in public health. Thank you so much.
100% agree. Thank you to you. Thank you to all of you. And have a happy new year, which will happen soon, hopefully to begin a better year. And thank you, everybody. Later out.
Bye-bye. See you in person, I hope, soon.
Exactly.
Bye-bye.
Bye.